Hi everyone. So it is time for our supplement roundup. And this is where I'm just going to go through really quickly, rapid fire, the supplements which you are most likely to encounter in the pharmacy and or the supplements that you might encounter in the pharmacy that might give you or your patients some problems. So we're going to go through it by disease state and approach it in this way. I like this way how we break it down. As we go through these different natural products, make sure you focus on the stuff in bold. That's the stuff I most want you to know or take away from this. But of course, you don't have a book necessarily that's going through all this, so I want to make sure that you uh, that you hit all the topics and you have sort of like my perspective on it, the perspective of the scientific community at large, and just the general recommendations you want to make for your patients who are using this wide variety of complex herbals. So let's get started with our anti-inflammatory and detox supplements. So first up, we have one that most people I think have used at some point in their lives, especially if you're from New England like me and you've gone to the beach and you're as pale as me. Oh boy, you have used some aloe. So aloe, or the Latin name aloe vera, is most commonly used as a topical supplement for burns. And it has the most supported evidence. It's a standard of care for sunburns to provide that cooling gel. And its polysaccharide chains are that active constituent which contribute to that wound and burn healing. Now, many people don't know this, but if you do consume aloe pills or aloe supplements orally, aloe is actually a fairly potent laxative and it's a stimulant laxative. Aloin is the compound which is responsible for the laxative properties, and it's actually been banned in many aloe products. I think probably since around 2006, because it's no longer GRAS certified. Recall from our previous lecture that GRAS certified means generally regarded as safe. And the Aloin is no longer GRAS certified because it has the potential to cause Barrett's esophagus, otherwise known, it's sort of like a scarring of the esophagus and a discoloration, especially with the aloin, which can lead to a higher risk of esophageal cancer. So we want to avoid any products which may contain aloin, and that could be unprocessed or unregulated aloe products. However, if you do consume aloe, there's also a chance that you might experience some of its stimulant laxative properties. So, much like senna, another famous natural herbal laxative, aloe has a similar effect where it irritates the gut and provides, I guess, the push to irritate it and cause the gut to expand and contract and get things moving. So, color me surprised, right? When I look at this and aloe vera has those both those burn and laxative properties. Well, there are aloe-based beverages, and it's not all, but it's not all that it appears. So there's varying levels of aloe content and possible health benefits. In fact, when I looked up this specific one, this aloe vera juice, uh, there were no polysaccharides within the juice, or at least labeled, and no sugars or anything labeled within the juice. So it even says on the tank, no sugars, starches, thickeners. So what's left? Because if you don't have the burn healing and it's or wound healing, anti-inflammatory properties, and you don't have the laxative properties, because presumably you've removed all of the aloin and anything that would cause a laxative, it's kind of just dirty plant water. Um, the gel has only proven to reduce inflammation externally as well. So, if anything, this might inflame your digestive tract. I therefore do not recommend digesting or drinking any aloe vera juice. Next up, in terms of anti-inflammatories, are quite popular ones, and that is glucosamine and chondroitin. And these are probably the ones with some of the most rigorous, some of the most rigorous evidence behind them. So chondroitin is a derivative of chondrin, which is a compound found in cartilage, and it's used orally for inflammation related to osteoarthritis. That's the arthritis of the joints sort of just rubbing against each other, right? Meta-analysis suggests the efficacy of chondroitin in relieving pain versus placebo after 3 months of use in patients with osteoarthritis specifically. And it reduced pain scores by about 20%, which is, I would say that's clinically significant. Its mechanism of action, it's thought to decrease the activation of interleukin 1, those inflammatory cytokines, which are responsible for a lot of our inflammatory responses. So yeah, chondroitin often is quite useful in patients with osteoarthritis, and it might be used as an adjuvant therapy or suggested therapy by someone's arthritis specialist. Glucosamine as well. Glucosamine is an amino sugar protein lipid precursor. It's often marketed for both rheumatoid arthritis and osteoarthritis. So but however, we know from meta-analyses, yes, much like chondroitin, it might be effective in reducing pain in OA patients or osteoarthritis patients, not so much in rheumatoid arthritis patients. So there was no reduction in swollen joints after 12 weeks within the patients who were only taking the glucosamine. However, their pain scores also decreased in a similar way. So this could be one of two things. It could be a little bit of the placebo effect, or it could be that those folks with rheumatoid arthritis were also suffering from some osteoarthritis on top of it, and it was interacting or at least lessening the inflammation caused by the osteoarthritic part of their total arthritis symptoms. So either way, combined efficacy, the jury is still out, but it looks promising because they certainly work fairly well apart from each other. Next, we have wheatgrass, which snuck into our top 10 natural products of the year 2023 and probably going to continue into 2024 and beyond. Uh, otherwise known as Wheatgrass is otherwise known as Triticum aestivum. Aestivum. That's a fun thing about Latin. You can just sort of make up a pronunciation. People think it's right. Uh, anyway, wheatgrass. It's often juiced, available in wellness circles. It's basically known for its nutrition. It's a really great source of vitamins A, C, and E, in addition to some of our metals, our iron, calcium, magnesium. That's all part of a healthy diet. If you go to a Jamba Juice or something like that, you can get a juice shot or lots of wellness stores or wellness boutiques. They'll give the wheatgrass shot. Doesn't look the most appetizing to me, but again, it is literally just grass juiced into a juice shot. Uh, Anyway, the usual shot is usually about 60 to 100 milliliters. There's no standardized dose because really it's not a supplement. It's just sort of a healthy drink to consume. Caution with leafy greens, of course, like anything else. If you're taking warfarin among other things, this could mess with the INR. Mainly, wheatgrass is known as an anti-inflammatory. It's known for its anti-inflammatory effects. It's quite popular in patients who have ulcerative colitis or general inflammation within the GI tract. It can also be used topically to treat inflammation, but to limited results. Its active constituent is apigenin. Now, apigenin is a flavanol with antioxidant and anti-inflammatory effects. It's specifically, we know that it has some effects in the GI tract, which is probably why those UC patients use it as a first choice. Well, not a first choice, I should say, but use it as an adjunct therapy or part of their diets, which isn't going to at least upset their GI tract. And there was a study in patients with colon cancer who were undergoing chemo, and that showed that a 60 milliliter juice shot of the wheatgrass, just juiced wheatgrass, it did have it increased IL-10, which is the anti-inflammatory cytokine. So it did by increasing those anti-inflammatory cytokines, it happened to decrease inflammation within their GI tract, which could have otherwise been due to the inflammation of the colon and the otherwise chemotherapeutic agents, which are going and being administered to the GI tract. So there's some studies that do show some benefits for a very specific subset of patient population that are benefits beyond basic nutrition. Now, there's very, very limited studies supporting efficacy, and there's lots of confounding variables because you're often eating other things, or you're maybe kind of self-selecting for the type of people who are most likely to drink a wheatgrass supplement on a regular basis. They're generally more health conscious. You have some confounding variables, even in wealth disparities, in social determinants of health, all of these things going together. But wheatgrass is certainly a healthy drink, if nothing else. Milk thistle. Another one of our detox supplements, Silybum marianum. It's marketed mainly as a liver protectant or detox supplement. So its mechanism of action, we know that we think at least that it has antioxidant or free radical scavenging, which is the property of silymarin, which is the active constituent. You can always remember the active constituent of milk thistle, Silybum marianum. The active constituent is named after it, silymarin. Silymarin, we know, alters the stability and toxin perfusion of hepatocytes in vitro, which suggests potentially that it's hepatoprotective. Now, this is in vitro. This isn't actually like in the body. So there's a lot more studies to go. However, milk thistle has been used for really since time immemorial, since when we first started getting written records of herbal medicine. We started to learn about milk thistle, especially in folklore medicines. Now, in oral supplementations, we know it appears in combination detox products, which again, we want to be cautious with our combo products because you never know what might also be within them, especially if there are multiple combinations of herbs within one product. But we do know at least that milk thistle has very few herb drug interactions. So that's one nice thing. It doesn't really interact with the majority of medications. If anything, it kind of protects the liver if the hepatocytes are, if the liver cells are being, overstressed, I guess you could say, by the other medications or the other supplements which the person is taking. Turmeric. You got to spend some time on turmeric. Curcuma longa, which was the number one best-selling herbal supplement of 2023, and it has been a long time fixture within the top 10 herbal supplements of the decade. So it is a rhizome, sort of a fancy word for root. I won't get into the botanical definitions, but it has this very distinct orange color. And it's used in Ayurvedic medicine, medicine from the Indian subcontinent in India. And it's very common and incorporated into the Indian cuisine. So you see it in curries and other traditional dishes, especially when you see that golden color. Now you have to note it's not the same as cumin. That is a totally different spice. Curcuma longa is simply the Latin name for turmeric. You're looking for curcuminoids specifically if you want to talk about anti-inflammatory properties, which of course is what turmeric is purported and has been studied to have. It's actually quite a decent anti-inflammatory uh, supplement, especially when it's used topically. Topically for joints, it's often suggested orally for IBS or irritable bowel syndrome. However, there's much more evidence for topical use. So, patient-reported pain scores decreased in statistically significant meta-analyses of folks who used turmeric daily on their joints, which were aching, versus placebo. However, of course, because it is a dye, you do need to counsel patients on skin or stool discoloration. Stool discoloration, of course, if they're using it orally, and skin discoloration if used topically. However, there's a problem if you use it orally, and that's why I'm not quite sure. Even though it's marketed as a supplement, you can take orally for IBS or any number of sort of body inflammation issues. The bioavailability of turmeric is extraordinarily low. So if you take turmeric orally, it has a bioavailability once it passes through your stomach and all the metabolism of about 5%. The rest is just getting excreted out. It's not going where it needs to go, and it's not going to really help anything, I guess, outside of the digestive tract, because it would at least come into contact with the digestive tract. But 5% bioavailability and 95% of it is eliminated, you would have to eat a whole lot of turmeric to get any sort of medicinal benefit from taking it orally. However, by bypassing that metabolism and administering it topically directly to the source of the pain, whether it's osteoarthritis of joints or a strain or muscle ache, you may have a certain benefit from that topical formulation because much like our ibuprofen, much like Voltaren, we have the inhibition of COX-2 prostaglandins, which have been observed when curcuminoids and turmeric extracts are rubbed on the topical parts of the body. So I would generally recommend, and you as pharmacists within your discretion, I would recommend that you say that yes, turmeric can work, but it's best used topically If you want to take it orally, just know it's probably not going to be doing all that much within your body when you can target the exact source of your pain and apply a balm, a salve, a lotion, what have you, with turmeric. Moving on to heart health, we have our essential fatty acids. So these are our essential fatty acids. The two most popular ones are EPA and DHA. DHA being docosahexaenoic acid, and EPA being eicosapentaenoic acid. Whew, say that 5 times fast. DHA and EPA. That's why we abbreviate them, right? Those are the ones that are most commonly uh, in your fish oil supplements. You might have seen these, but these are essential for health. They are good for lowering high triglycerides and increasing your HDL or your good cholesterol. And they cannot be obtained, or rather, they can't be synthesized within the body. So we need to obtain our essential fatty acids from diet. How do we do that? Fish oil is probably your best option. There's supplements available, including prescription strength supplements or medications, which are fish oil derivatives that are a brand name of Lovaza and Vasipa, which contain EPA and DHA. Although one of them, which one it is, that actually escapes me, has only EPA, and the other is a combo of EPA and DHA, but they essentially do the same thing in supporting your cardiovascular risk, lowering that cardiovascular risk by lowering your triglycerides. Now, if you have a vegetarian or vegan patient who's not particularly interested in using fish oil supplements, which I think is perfectly understandable. They also don't taste the best if you have that fun side effect of the fishy burp, which comes with it. Yes, patients complain of having a fishy burp after consuming the supplements. You can go for ALA, or alpha linolenic acid, which is derived from nuts and flaxseed. It's also an essential fatty acid, works very much in the same way as EPA and DHA to lower high triglycerides and increase your good cholesterol, your HDL. And of course, sources of essential fatty acids, if you do choose to take fish and just have them in your diet, salmon's probably your best bet. Think of oily fish. So salmon, herring, anchovy, if you can stomach it with all that salt, sablefish, whitefish, tuna. Think of your oilier fish. Those are going to give you the most in the way of essential fatty acids. Garlic. Speaking of some more smelly supplements, garlic is otherwise known as Allium sativa. Garlic bulbs, also called cloves, contain multiple active constituents, some of which contribute to garlic's odor. Garlic's odor specifically, it has to do with organosulfur compounds that are responsible for the smell. So allicin and allicin, again, allium, allicin, those chemicals are the most popular chemicals that are attributed to cardiovascular health that within when taking garlic. However, when they're broken, they are organosulfur compounds. So what makes you have the smell when those bonds are broken, those sulfur bonds are broken? It's just like if you're at Yellowstone Park and the hot springs smell like rotten eggs, or if you get like a perm or something like that, and those sulfur bonds are breaking, and you smell that really pungent odor. It's the same idea. Those organosulfur compounds are breaking down, and that's how we get your famous garlic breath. Again, cultivated for food and medicine for thousands of years, beginning with the Babylonians, literally the cradle of civilization. Since then, we've had the use of garlic in both cuisine and health practices. And it has great cultural significance, especially in Europe. Shout out to my Romanian friend and all of our good talk about vampires. It's generally marketed as a supplement for cardiovascular health today, primarily in lowering blood pressure, cholesterol, having lots of antioxidants as well. And then you'll see with a lot of sulfur compounds, they market it quite often as a detox supplement. Next is a fun one for heart health, resveratrol or red wine extract. So resveratrol is a stilbene, which is a non-flavonoid phenolic. All that means is it has some phenol groups, and it is a phenol group, and it has these uh, distinctive OH groups off of the aromatic rings. And it's found in small quantities in grapes and red wine. Very plentiful in Japanese knotweed as well. You might see some resveratrol products derived from knotweed when, say, they're not able to when wine prices go up or grape prices go up. And resveratrol is responsible for what's known as the French paradox. So we know and have documented, and scientists have written about the French paradox, in that there's a lower incidence of heart disease in the French population despite the consumption of a high fat diet that's correlated with the consumption of red wines. Right. So the idea is that French people are not eating particularly healthy. They're if you've ever seen Julia Child's cookbook, I mean, it's butter and creams and all these different pasta dishes and these rich foods, cheeses and croissants and breads, you name it. However, they quite consistently drink red wine. So there was an idea that the resveratrol in the red wine might be causing them to be healthier because they're taking it sort of like a vitamin on a regular basis. However, this is quite possibly correlation without causation. Uh, there's a lot of difference in the lifestyle of people in France than the lifestyle of people in the United States. People walk a lot more often. Cities are more accessible. There's a different sort of pace to the lifestyle. There are different priorities. There are different, it's a different health system. Health outcomes are different. There's lots of different confounding variables, which might seek to disprove the French paradox. However, resveratrol is still marketed for its antioxidant and cardiovascular health effects. But I did a little deeper dive. So if we were to do resveratrol by the numbers, let's take a typical resveratrol supplement. So studies indicate that 1.5 glasses of red wine per day. So this is what we would say a typical, I don't know, French adults would drink with their evening dinner. It provides about 2.56 milligrams of resveratrol. Many resveratrol supplements are standardized to contain 350 milligrams of resveratrol per capsule, and they're taken once daily. So that is equal to about 205 glasses of wine per day. Otherwise, 41 bottles of wine per day, or 8.2 gallons, 31 liters of wine per day. That's the equivalent that you would have to drink in order to get the amount of resveratrol in that one capsule. So it's hard to say if they're getting enough resveratrol from their diets to justify the French paradox. However, therapeutically, at these much more greater doses, there are some studies which may support the reduction of cardiovascular risk, which may or could be attributed to resveratrol consumption, but it's probably not coming from your glass of wine. There's also many people who are interested in alternatives to statins. And in fact, we found one that was so good it was made into a statin itself. Red yeast rice, which is generally not found in the US anymore, mostly found in traditional Chinese medicine formulations, or Peking duck, if you've ever had that. It's like a red Chinese chicken dish, or sorry, duck dish. What am I saying? Uh, well, red yeast rice was synthesized, and they found after studying red yeast rice, which is this naturally occurring yeast that grows on fermented rice products, that it was had monocolin K, this compound called monocolin K in it. And monocolin K is actually the active ingredient which became lovastatin. So it actually became a statin medication. Now, we run into some issues with this. Why? Because obviously a dietary supplement cannot be prescription strength, or else it would be a drug. So red yeast rice supplements are generally not easy to find in the US because it very much straddles the line of a supplement almost being a drug, and therefore it would be illegal in both sections because if they're selling it as a drug, they don't have the approval of the FDA to do that, nor do they have the standardization required for it. However, a lack of standardization in the dietary supplements like red yeast rice, or what we would call herbal supplements like red yeast rice, a lack of standardization can be quite dangerous because you can take red yeast rice products and the ones you buy in the dollar store may have little to no therapeutic effect at all because they have very little red yeast rice. However, one that you buy at, say, a Chinese market or from a TCM doctor working in the States as an independent herbalist, that might actually be prescription strength. So we have to be careful. CoQ10 is another thing that's marketed as an alternative to statins. It doesn't appear to lower LDLs in several studies and meta-analyses, but we know it might reduce total cholesterol by about 6% in combination with some of our fish oil supplements, some of our EPA and DHA. Now, is that clinically significant? Not necessarily. But if maybe someone is on the cusp and you just want to push them down just that little extra bit further into a lower cardiovascular risk category, adding CoQ10 to their vitamin regimen, it wouldn't hurt. Cholesticare is also another one. It's a plant steroid blend. It was featured on QVC. I had questions about this. It might theoretically inhibit cholesterol absorption rather in the gut by binding to it during digestion. That's the idea behind it. There's really no great evidence. Now, for fun, I put in the QVC advertisement for Cholesticare. You can watch this on your own time by yourself because some of the stuff they're saying, it might not be legal to say on the bottle, but they certainly don't avoid saying it on QVC. So, anyway, next one. This is another up and comer, which somehow snuck into the cardiovascular category, and I'll explain why. Psyllium or Plantago ovata, so otherwise known as blonde psyllium. It's best known as a bulk forming laxative. So you would have gotten this in your self care course, right? It's a bulk forming laxative, stool softener. The insoluble fiber adds bulk to the stool, which helps it with constipation and regulating bowel movements. The soluble fiber forms a gel-like substance and aids with digestion. So we have our insoluble fiber and our soluble fiber working together to produce a bulk forming laxative and stool softening effect. What does this have to do with cardiovascular health? Well, we know that consuming products with soluble fiber might reduce the risk of coronary heart disease or CHD. The same kind of concept as to why Cheerios are a heart healthy cereal. However, we have some stipulations. It needs to be 7 grams or more of insoluble fiber per day required to reduce this risk of CHD. And it also has to be part of a balanced diet, which is low in saturated fats and cholesterol. So if you meet that criteria, well, sure, maybe a psyllium supplement might be right for you. It may help lower our LDL, low density lipoprotein levels, especially when used in combination with other cholesterol lowering medication and healthy dietary choices. So it's significantly increasing in popularity as a supplement, and I don't see it going away anytime soon, as this is a fairly recent trend. So just know that psyllium, the patient buying it might not necessarily be buying it just for its laxative properties. They might be looking to get some heart health out of it as well. Next, diet and diabetes. So we've got cinnamon, Cinnamomum verum. Well, it has those volatile oils or terpenes. Terpenes are what we think of when we think of aromatherapy. And they're suggested to contain the active constituent cinnamotannin B1, which may work synergistically with insulin through multiple mechanisms of action. We know it might help to lower postprandial glucose, enhance cellular glucose uptake, and stimulate insulin release. But we have mixed results with in vitro and animal studies. And honestly, these results, they might be significant statistically, but not necessarily clinically, especially when applied on a larger scale to a larger cohort of human subjects. And these quality studies, the other problem with them was they really were short duration. So it's hard to assess A1C when the study is only a month long. Because what is A1C? A1C is a measure of the past 3 months of your sort of average sugar levels, to put it, in layman's terms, or how I would explain it to a patient. So if you're looking at A1C control and you're looking at A1C trends, you're not going to get that full trend after just a month of taking the cinnamon supplement and then trying to measure things. So standard dietary cinnamon intake is unlikely to have any significant effect on diabetes. Not to say cinnamon isn't healthy, because it is. It's a nice spice to add to your food, but it doesn't go much farther than that outside of animal studies. But you might still see cinnamon supplements regularly for purported diabetic health support. Curelen, a combination supplement for advanced glucose support. So again, this is what I was warning about in the previous presentation. The Curelen contains 10 ingredients or extracts which are combined into one capsule. So it has turmeric, among other things, bitter melon, which is an insulin analog, Ayurvedic and TCM plant extracts. It's all within these things. And yes, these ingredients are clinically tested, but we don't know how they interact with each other. So we might think of herb drug interactions, but what studies are there for herb interactions between turmeric and bitter melon? Who's to say we're not going to send someone into hypoglycemia if we're administering this? Or who's to say that one of the Ayurvedic or TCM plants doesn't simply cancel out the therapeutic effect of what some of the other herbals within that same combination might otherwise be reacting through metabolism in the body? It's hard to say because we don't have the studies to back this up. There's also so not only do we have no synergistic studies, we also don't have any proof of efficacy for these products at the quantities present within the capsules. So, like I said, turmeric is something like 5% orally bioavailable. If there's turmeric in that capsule and it's one of 10 constituents packed into that capsule, so I don't know, by volume, maybe it's 1/10 of the capsule, you're taking 1/10 of whatever milligrams of turmeric or curcuminoids that is standardized into the Curlin capsule, and that 1/10 is being absorbed. It might get bound to any other number of plant extracts within that capsule, and then ultimately only 5% of the anti-inflammatory curcuminoids are going to be absorbed of that already small dose. So is it going to have a great effect? I don't think so. Green coffee bean. Good old Dr. Oz popularized this one. Green coffee beans aren't any different than normal coffee beans. They're just raw, regular coffee beans which haven't been roasted. So the whole extract of these coffee beans is used. It was marketed as weight loss supplements by Dr. Oz on his famous TV show before he found his role in government. Uh, and before that, or I should say, after he started marketing it on his TV show, you can click the video here and see how he was grilled sort of in front of a congressional committee. It's difficult, this type of claims that he was making, but due to these claims and due to the popularization of the green coffee bean extract, we got a lot of these green coffee bean products on the market. So the mechanism of action is that caffeine can inhibit fat, or it can inhibit rather appetite and fat absorption in humans. We know that's true. Green coffee bean extract was only marginally successful at doing this in animal studies. In fact, notably in one mouse study, the green coffee bean extract only succeeded in giving the mice diabetes. Yeah, it's not great, folks. It's really not great. Uh, You can talk to Dean Madison a little bit more about this, but I always emphasize that there's no magic weight loss supplement or diet. It's just consistency and self-accountability above all else. Immune health. This got huge immediately post-COVID, and there's still lots of things to talk about here. So we have echinacea, Echinacea purpurea, otherwise known as the purple coneflower. So you might have walked by these in gardens and never known that they were medicinal, but they're certainly beautiful. And there's multiple dosage forms: capsules, tinctures, teas. If you've ever taken an airborne gummy, those little nice gummies that you see sometimes at grocery stores or in airports, that is simply Echinacea purpurea and ginger put together sort of for immune support and also kind of an anti-nausea for when you're about to go on an airplane. Mechanism of action. We know that echinacea, its polysaccharides appear to increase macrophage proliferation and interferon secretion. Essentially, it's sort of jump-starting that immune system and increasing the role of macrophages in the body to scoop up any invaders that they might find. Now, the majority of analyses conclude that echinacea may have modest effects on supporting immune function and that it's helpful with prevention, but not treatment. So when you think of echinacea in terms of supplementation, it is best used for prophylaxis before someone is sick, rather than uh, actively treating someone who is sick with a cold or flu. Elderberry, or Sambucus nigra, is the other quite popular dietary supplement, herbal supplement used in immune health. It's often sold as jams with other berries or fruits, tinctures, teas, or other oral dosage forms for immune prophylaxis or for the treatment of influenza or cold symptoms. Now, I use treatment loosely there. I would say supporting uh, a speedier recovery from influenza and cold symptoms. And there is actually some data to back up elderberry's use in this way. So mechanistically, the extract appears to inhibit viral replication of influenza in vitro, including H1N1 or swine flu, which is nice. So if it's inhibiting the replication of the flu virus in vitro, that means that your duration of the flu might actually be shortened by, I don't know, a day, or at least your symptoms might clear up a little bit faster. Sort of like a poor, sort of like the same role as oseltamivir or Tamiflu. It's that same idea is inhibiting the replication. We also know that PACs or PACs are known to be immunomodulators with antioxidant effects, which eliminate free radicals, uh, promote cellular respiration, among other things. PACs, all those are those proanthocyanidins. They just give the elderberry and other berries like cranberries, blueberries, you name it, their characteristic red and blue colors. I would say among elderberry and echinacea, these are the strongest. These have the strongest evidence of all of the immunomodulating supplements, mostly because they've been tested quite a lot. We've known about echinacea and elderberry for decades, and there has actually been a vested interest in studying these things uh, in terms of their immunomodulatory properties. L-lysine. L-lysine is not a it's not an herbal medicine, but it's used orally in topical balms as a supplement and also a treatment for cold sores or the herpes zoster HSV. And it's has antagonism of HSV replication. The exact mechanism of action is unknown and it's pending further research, but we do know it kind of works. It's best achieved topically with the application of lysine plus zinc to a cold sore every 2 hours. And that does clinically reduce the severity and healing times in multiple controlled trials. So this is very evidence-based. Oral supplements, however, have limited efficacy. So if we're not using it topically, it's not the best. Meta-analyses suggest that 3 times a day dosing of up to 3,000 milligrams a day of L-lysine really has no clinically significant benefit to, say, preventing cold sores. However, once you have one, it's useful in addition to zinc to use it. Likewise, I've mentioned zinc. Zinc, of course, has several recognized medical applications. Zinc deficiency, reducing diarrheal symptoms in zinc deficient children. Even Wilson disease. You don't really see Wilson disease very often, but I recall there was a rather entertaining episode of House where someone had Wilson's disease. That's the inability to eliminate copper. Zinc increases the copper elimination in stools, replacing copper uptake. The mechanism of action for immune support with zinc is actually quite strong too. It's a natural component of neutrophil and T cell function. So we also know that zinc inhibits rhinovirus replication in vitro. So within the body, it does inhibit rhinovirus replication, and evidence suggests that zinc lozenges, which you can just sort of park under your tongue or subbucally, may shorten the duration of common cold symptoms, or aka rhinovirus symptoms, by about 2 to 3 days, which can be really a game changer if you've had the cold and it's been going on for 2 weeks. If you can shorten it and you regularly take zinc supplementation, yeah, that can help. There's also a possible correlation between zinc deficiency and patients with acne, actually. So sometimes zinc supplements might be used in patients, or patients might be referred to use zinc supplementation by dermatologists. So just things to keep in mind. Sleep, anxiety, and depression. All right, so let's talk kava, Piper methysticum. It's actually related to the pepper plant, actually. Black pepper has in the same genus of Piper. It's used in Polynesia for millennia as a natural medicine for anxiety and sleep. And the ground root of the kava plant contains the active constituents. So generally, kava is dosed in tea, in paste, in capsules. It's often traditionally it's drank in kava ceremonies, which are quite significant ethnobotanically and culturally for Polynesian folks. So people from the islands of Hawaii, of Vanuatu, of Fiji, they all have their different kava ceremonies and reverence for the kava plant within their respective cultures in the South and Mid-Pacific. We know that kava might be possibly effective for mild non-psychotic anxiety, and it does sort of hold up. It's possibly effective when compared to buspirone 10 milligrams or oxazepam 30 milligrams in terms of patient self-reported anxiety, it was found to be non-inferior in some studies. So sort of not any better or not any worse. The problem with kava is that it has the potential, especially if the supplement is not adequately standardized, to be extraordinarily hepatotoxic. There were cases of FDA letters sending cease and desist and significant recall warnings for certain kava products which were marketed in the US in like the early 2000s. These kava supplements, often combination supplements, sent people into liver failure and onto the liver transplant list. So, very serious potential for hepatotoxicity. We generally frown on recommending kava for those reasons. Valerian root, or Valeriana officinalis. It's marketed for supporting sleep and relaxation, and we know that it's possibly effective because most clinical trials suggest that valerian supplements decrease time falling asleep, which is otherwise known as your sleep latency, and they decrease restlessness related to anxiety. So this is patient self-reporting on different surveys, personal surveys, and its mechanism of action kind of aligns with it makes sense when you look at it. Valerianic acid might increase concentrations of GABA by inhibiting GABA catabolism enzymes and limited binding, and also has limited binding to our serotonin receptors. All of this, if it's inhibiting the GABA catabolism enzymes and more GABA is sticking around in the brain, we know that GABA can have a sort of sedating effect. It kind of calms the brain's activity down, and it might help contribute to that at least better time or easier time falling asleep. Maybe not staying asleep, but at least falling asleep and feeling less anxious. Side effects and considerations. Valerian, the flower smells quite nice. The roots, which are the most medicinally potent part of the plant, smell, and I'm using this term scientifically, they smell like sweaty socks. So bad breath and body odor may occur with prolonged use of valerian root supplements. So sort of at your own peril. They also do have some mild to moderate CYP3A4 inhibition, so just keep that in mind if a patient is taking valerian and they have other drugs which are metabolized through the CYP3A4 pathway. Ashwagandha or Withania somnifera. You can always tell that something's going to be put you to sleep if it says somnifera right in the Latin species name. You know, somnolence, falling asleep. So ashwagandha has had a growing popularity in the United States, and it has an extraordinarily long history of use in Ayurvedic or traditional Indian medicine practices. Not just Indian, but also South Asian traditional medicine systems. We're talking Thailand, Indonesia, you name it. It's often marketed as an adaptogen. Adaptogen is kind of a nice term to say it's a cure-all. Uh, Ashwagandha is not a cure-all, but does have some evidence-based indications. Those evidence-based indications are mainly for anxiety, because there are meta-analyses that indicate that after about 6 to 10 weeks, patients taking between 600 to 1200 milligrams orally of these are tablets of ashwagandha per day, or not tablets, but capsules of ashwagandha per day orally. They reported moderately improved anxiety scores when compared to placebo. And these scores were clinically significant. The patients did have quite a good response, and they continued with the ashwagandha post study. In the way of insomnia, patients also reported a more restorative sleep. So maybe they still had trouble falling to sleep, but at least as once they were able to fall asleep, they woke up feeling rested. And that is quite an accomplishment for a plant to achieve. The anxiolytic, the anti-anxiety mechanisms of action are unclear. It might be because ashwagandha and the active constituents within ashwagandha have some GABA agonism, and that means the inhibition of neurotransmitters might calm people down and reduce anxiety, but it's really relatively unknown. We do have some evidence that says it works, but we don't know the exact pathways. And as always, if we don't know the exact pathways, we don't know every single drug that it might interact with. So use with caution. Now, on the opposite end of the spectrum, we know this drug. It's as every pharmacist's worst nightmare. This is St. John's wort or Hypericum perforatum. So it's a flowering plant native to Europe. It was used for millennia to ward off evil in traditional folk medicine. It's called Hypericum perforatum because Its leaves have little perforations, little natural holes in them, as you can see right there. That's why it was named that way. It has It is a poster child for drug interactions. It had major drug interactions, including CYP3A4, 1A2, 2C9, and 2C19, which reduces the efficacy of just about 80% of drugs on the market, which go through all of these pathways. That is including all of the below. Benzodiazepines, it reduces the efficacy of them. It reduces the efficacy of contraceptives. I'll never forget this story. I was because it seemed like an Oski case when it happened to me. I was working at Walgreens, and I still remember what she looked like to this day. It was this younger, like college age girl. She was coming up. She was picking up her birth control at the counter, at the prescription counter, and she had a bottle of St. John's Wort, a supplement that she was hoping to buy. And I go, this has to be a trick. This is like, when they try to make like the 15-year-old cashier cash out the person with like the chainsaw, that kind of thing. This has to be it's like, so I go to her and I say, like, does your doctor know that you're taking the St. John's wort along with your birth control? And she goes, no, no, I just heard about it and I thought it was be good to treat sort of anxiety and depression and that kind of thing, like help with my mood. And I go, I mean, yes, by itself it would, but did you know that if you were to take this contraceptive along with the St. John's wort, you would have to use other forms of protection because the contraceptive would not work. Now, I always finish that story saying, just imagine how depressed and anxious she would be if she found out her contraceptive was not working. But that's where you can make a difference, right? As a pharmacist at the counter, as a farm intern at the counter, like if I hadn't been there and it was just a tech that was not paying attention or didn't know the significance of that drug interaction and just like let her go out, who knows what could have happened? And who knows if someone had let her pay? She ended up not leaving with the St. John's wort. So anyway, my little soapbox. You can truly make a difference if you recognize these herbal problems. But anyway, reducing the efficacy of any number of drugs, cyclosporin, transplant rejection has been documented in St. John's wort users. I mean, HIV drugs, warfarin, all of these drugs with narrow therapeutic indexes really can very much get out of whack if St. John's wort is used concomitantly with them. Now, if someone does use a St. John's wort supplement, it should be standardized to hypericin or hyperforin, both of which function basically like an SSRI, which is why you also shouldn't take St. John's wort in addition to an SSRI, because there's a risk that is heightened for serotonin syndrome when they're used concomitantly, because you're triggering the same mechanism of action. Now, therapeutically, it could be effective, but only for mild depression. And I would also tack on to that informally, only if the patient is literally taking no other medications. Memory. We have two main memory supplements. We've got ginkgo biloba, which is a very, very cool plant. It's a living fossil. It's one of the oldest plants. It's been around since the dinosaurs in its own form, and it's the only one within its whole genus, ginkgo species, which is alive today. It's marketed as a memory enhancing supplement, and meta analyses of patients with mixed or vascular dementia do actually show modest improvements in activities of daily living or their ADLs and cognition after about 22 to 24 weeks of ingesting 240 milligrams of ginkgo extract daily. So again, in that small subset of patients who might be experiencing cognitive impairment, ginkgo can help promote blood flow to the brain. I always remember ginkgo makes blood go to the brain. What is the active constituent? You have ginkgolides. Super easy to remember, right? Ginkgolides might increase blood flow and they have slight anticoagulant effects. And we know they're able to pass through the blood brain barrier to enhance essentially vascular flow within the brain, albeit slightly. Of course, this comes with a caution. You have to be cautious in patients with bleeding disorders if they do take ginkgo supplementation. And indeed, you probably should not recommend any patient who is at a large or even moderate cardiovascular risk to take ginkgo biloba without a consultation with their prospective healthcare providers or cardiologists. Prevagen. If there's one mission I have in life, it is that it will no longer be the number one pharmacist recommended brand. for memory support. So Prevagen, you might have seen the commercials with like the jellyfish or like the old pharmacist saying that he likes Prevagen because it helps him stay on the bench, and he's been on the bench for 40 years. It's marketed as the number one memory enhancer. It's synthesized from jellyfish or apoequorin. Apoequorin is the name of the active constituent. I use air quotes, active constituent within Prevagen. Uh, of course, you would use an animal that has no brain for a memory supplement, right? So Prevagen got its healthier brain function, sharper mind, clearer thinking, these qualified health claims all on it, and the qualified claim that it improves memory, all because of one study that it made, which was open label design, so people knew that they were taking it. It had 218 participants, a small n, and there were non-standardized assessment questions. So instead of doing like a standard cognitive test that's been proven, like accessible for like say Alzheimer's or dementia patients, no, the Prevagen folks decided, well, the best way to figure out if um, the best way to figure out if our product is really effective is to give them Prevagen, show them that they're taking Prevagen, and then have them write if they feel like they're thinking more clearly after taking the Prevagen. That's like randomized controlled trial blinding like 101. Like you don't do that if you want an accurate and non-biased result. However, that's the study Prevagen runs with, and that's the study they continue to promote. Independent studies, however, suggest limited to no improvements in patients taking Prevagen. There's misleading marketing. I have called the Prevagen people, actually. They are not that friendly when you bring up those studies. So just please help me. Please go forward out into the world and make Prevagen not the number one pharmacist recommended brand if you learn anything from this presentation. You can see the lawsuit on Prevagen that it doesn't boost memory. I highly suggest that you check this out and we'll figure it out. All right. Next up, women and men's health. Thank you for bearing with me, by the way. I know this is a lot of information, a lot of material. Black cohosh, or Actea racemosa. It's used to treat menopausal symptoms such as hot flashes, night sweats, and vaginal dryness. So it acts as a selective estrogen receptor modulator, or SERM, or SERM. And it has those effects on certain tissues, meaning it acts as a phytoestrogen or a plant-based estrogen to sort of substitute the estrogenic effects, which people, women of women who are in peri or post or pre peri menopause, postmenopausal symptoms, vasomotor symptoms. It helps with the sort of estrogen replacement using a plant-based alternative to estrogen, which the body otherwise would produce. So it's taken daily as capsules with plant extract. It's unsafe in pregnancy. This is important. So women who are pregnant or planning on becoming pregnant should absolutely not use black cohosh. It might induce labor, may induce contractions. There's conflicting efficacy reports, and this is an interesting sort of cultural perspective. USP, the United States Pharmacopoeia, suggests that it might be possibly effective, whereas according to German Commission E, which is sort of the equivalent of the US Pharmacopoeia in Germany and the European Union, it's actually labeled as a standard of care or as an adjuvant therapy for women experiencing menopausal, postmenopausal vasomotor symptoms. So it's interesting to see the different studies which were conducted in Germany versus the US, which led to slightly different conclusions. However, you'll see a lot more black cohosh over in Europe than you will see in the United States because of this. Soy is also a popular natural product and also food for this sort of women's health category. Soybeans, of course, are a dietary staple. We grow a ton of them here in the US, and consuming soy protein of about 15 to 60 grams, which provide in turn about 34 to 100 milligrams of soy isoflavones, and this is daily, seem to modestly decrease the frequency and severity of hot flashes. And again, why are these soy isoflavones decreasing the severity of hot flashes? Well, they're acting as phytoestrogens. They're activating those same estrogen receptors, acting as a sort of estrogen replacement, and they're improving the symptoms of these women who are going through menopause. Limited evidence in longitudinal studies also suggest that a very high dietary intake of soy might decrease patients' risk of breast cancer. There's a lot to read into for this. There are some interesting studies. I don't think anything is definitive yet, but you might also see patients bring this up to you. And then we have saw palmetto or Serenoa repens. So it was used to relieve symptoms of benign prostatic hyperplasia or BPH. This is in men of the prostate gland. It's important to note that BPH is a non-cancerous enlargement of the prostate. So it doesn't have anything to do with a cancerous growth that cannot be uh, lessened or treated with saw palmetto under any reasons that might need to be surgical or other options. However, when the prostate gland enlarges with BPH, it increases pressure on the urethra in the male bladder system, and that causes frequent or urgent urination, especially at night, a weak urine stream, and the feeling that the bladder is not sufficiently empty, which can be quite frustrating. So, what is the efficacy on saw palmetto? Honestly, it's to be determined. There's lots of contradictory evidence in the treatment and management of BPH. There's a lot of statistical but not clinically meaningful uh, evidence relay like attributed to saw palmetto supplements, Serenoa repens, extracts, and things. I would also say Serenoa repens, saw palmetto is also quite easy to adulterate because literally it's just sort of like the oils from the palm plant. So you get a lot of these supplements which are just 90% palm oil and then maybe some from saw palmetto. So are you really getting the therapeutic benefit which you're buying? However, in a controlled setting, there is some indication that saw palmetto might be useful therapeutically in this one subset of patient population, and that is that it's had promising results after transurethral resection of the prostate, or TURP surgery. So after an enlarged prostate was resected for whatever reason, was sort of like cut back, and they helped the urethra sort of get free of that enclosement. 320 milligrams orally once a day improved outcomes and recovery time, specifically led to fewer complications and decreased the duration of the catheterization that was needed post-op. So saw palmetto has some use, albeit a narrow use in pharmacotherapy. Over the counter, it doesn't really interact with a ton of medications. It's probably safe to use. I remember when I was at URI, I went up to the urology professor from Brown, who was our guest lecturer, asked him if he recommended it to his patients, and he basically told me it can't hurt. So I don't think it hurts. If it helps some people, that's good. So to tie it all together, let's do a patient case study. And this case study is real, by the way, because this is something that I encountered on my Appies. So as you go forward into your pharmacy life, know that you can make a difference, just like I found with this woman. PL was a 55-year-old Caucasian woman admitted to the cardiac ICU who presents with a history of sudden onset palpitation and syncope with no associated chest pain or shortness of breath beginning 1 week ago. Medical history. She has asthma, back pain, hypothyroidism, and obesity. So she's 5'4", 185 pounds. Her BMI is 32. She had a QT of 540, QT interval. 400 to 440 was the normal value. So we're trying to figure out why her QT is so prolonged. Why does she have such long QT prolongation? Patient had 1 to 2 drinks of red wine per week with dinner, she reports. She's currently dieting. She's lost 5 pounds. And she watches the Dr. Oz show regularly. This was back when Dr. Oz still had his show. And that is a red flag for any person who's a supplement buff like me. But anyway, let's talk QT interval, right? So the QT interval is a measurement made on an electrocardiogram to assess some of the electrical properties of the heart. It's calculated as the time from the start of the Q wave, right over here, to the end of the T wave. And that approximates the time taken from which the cardiac ventricles start to contract to when they start or when they finish relaxing. And an abnormally long or abnormally short QT interval is associated with increased risk of developing an abnormal heart rhythm, arrhythmia, and sudden cardiac death. So this woman was rushed to the emergency room. We were looking at her medication list because she had presented to us at an Amcare pharmacy in the clinic, which was down from the hospital across the street. And we were looking at our med list and we were trying to figure out what it was, like what was going on here. And so we look and she's just taking, levothyroxine, that's fine, ProAir, tramadol, Tylenol, vitamin C, vitamin D. I mean, she's taking two two pain meds at the same time, so you kind of wonder about that. But other than that, there's nothing too, I don't know, alarming for what she's taking. And then we asked about supplements, and we looked deeper in her profile, and there was a whole list, an addendum, a note with all of her supplements, and check out what she was taking in addition to that. This is horrifying. So remember when I said how combo supplements might be a little bit dangerous? One of the things that I noticed immediately with these is you had a lot of repeat detox supplements, lots of like inflammaway, innate detox, liver detox, all these wild things. And I kept seeing dandelion come up with each of these as I researched and I went on the websites and looked at them. So I go, oh my gosh, wait, what is us look at dandelion. What compounds are in dandelion? Well, dandelion, Taraxacum officinale, it's used in foods. Dandelion salad. I've had dandelion salad before. It's quite good, if bitter. It's mostly considered a weed, but it's brewed in teas, extracted in tinctures. It's a topical analgesic for tonsillitis. And it has GI effects, sometimes increase in appetite, decrease in flatulence, could act as a diuretic. But wait, it acts as a diuretic. What does it do with other herbals? Because if that she's taking 50 plus something herbal medications and all of these supplements, there's a synergistic effect with other herbals, which causes antiplatelet effects, which include, and these are the ones that she was taking. You recall ginkgo. Ginkgo makes blood go to the brain. Dandelion interacts with that, causing further antiplatelet effects, as well as garlic, as well as turmeric, others. Hypoglycemia, she's at risk for that. The roots, however, the dandelion, are absolutely filled with potassium. So that carries with it a hyperkalemia risk, especially with potassium sparing diuretics like spironolactone, and EKG changes like arrhythmias. So I looked this up. I do like a drug information search, and I find a case report that is almost, it's remarkably similar to our case. It's from like the early 2000s, 90s, directly related to dandelion containing herbal supplements for weight loss. 39-year-old obese woman presenting with palpitations and fainting. The QT prolongation is big. Ventricular tachycardia. She went into VFib, eventually progressed to torsades de pointe, which is very nasty territory. So here's you versus the supplement she told you not to worry about. Here's what you should be. This is what the poor dandelion lady, what her EKG looked like. So what eventually happened? With our patient, her symptoms improved after stopping her supplements during her hospital stay. She's treated with amiodarone inpatient. We stopped the dandelion. She met with a hospital nutritionist to discuss cardiac diets. She was discharged in excellent condition. The original case report, our poor person was not so lucky. He stayed on the amiodarone for about 6 months. He ended up with a cardiac defibrillator implanted during the hospital stay to prevent recurrence, but he did have a normal EKG observed at 1 year follow-up. Oh, also, I mentioned this. The N-acetylcysteine, NAC, was part of some of the detox supplements that my patient was taking. N-acetylcysteine is best known as the antidote for acetaminophen toxicity, which is usually given IV to patients who have overdosed. It's usually given IV because it stinks. It's another sulfur hydryl group, so it tastes and smells like rotten eggs, so it's not really nice to take orally. Commonly causes nausea and vomiting when taken orally for that exact reason. And it works best if taken before acetaminophen consumption. So greater than 4 hours, there's a different treatment curve that limits the efficacy if someone were to overdose on acetaminophen. But what did I notice about these N-acetylcysteine supplements and this woman's medication list? She was also taking Tylenol. She was doubling up on pain medication, and she was taking enough N-acetylcysteine to cancel out the Tylenol. So again, it's one of those things where you're just working against yourself, and if you want to deprescribe, this is a perfect opportunity. So anyway, I guess if that case teaches you anything, if it teaches you anything, it is to look out and use that herbal mindset alongside your medication mindset as you go through the world of pharmacy. Because your patients, regardless of how you believe in those supplements or how efficacious those supplements are, they will still take them, and they are going to look for you to help answer their questions and to give them the most sound health scientific advice that they require. So if you have any questions, feel free to contact me. And it has been an absolute pleasure sharing some of my favorite herbs with you.